And I'm just going to say this. If your hypopigmentation is due to bleaching creams, because I know a majority of people watching this video wants the solution for hypopigmentation secondary to bleaching creams, I have two things to tell you. Factors like humidity, environmental factors, maybe genetic predisposition, excessive oiliness on the skin, using oily creams or lotion on your skin. Hi beloved, welcome back. I'm so happy to have you here, and thank you so much for the love on my last video, the video on what was it again? I don't remember. What were we talking about? Yeah, the video where I rated top viral hyperpigmentation. I'm so appreciative of that. Thank you very much. Today we're going to get into hypopigmentation. I promised that in that video. I didn't upload it next, but yeah, let's get into it today. What's most special about this video is I'm not just going to be teaching you about hypopigmentation. We have a real life case study, and that's me. I have had this condition before. So as we get along the video, as I'm teaching you about this condition, we'll discuss my case study as well, how I developed it, what I did, what my diagnosis showed, what my treatment was like. So stay tuned. If you're not here for the clinical knowledge or scientific knowledge, stick around for the experiential knowledge, because I've gone through this condition, so I really understand, and I'm going to break it down to you in a way that you understand. Before we do, let's get the verse of the day. If you're new here, we read the Bible and we practice it, or at least try to, with the help of the Holy Spirit. Psalm 29 verse 11. The Lord gives strength to his people. The Lord blesses his people with peace. I needed that. Amen. Let's jump into it. So for the outline of this video, this is what we'll be following. So you can check the timestamps and cut straight to the chase. But I'll advise that you grab your pen and your paper and listen carefully to this video, because you're going to learn so many things in this video. Definition of terms. What is hypopigmentation? That's basically decreased pigmentation compared to surrounding skin. So you can have, like, this is my skin, right? And then I have like hypopigmentation here. That is decreased pigment in this area compared to the surrounding skin. And this term is different from depigmentation, which is actually like complete destruction of melanin producing cells. So you don't have any melanin in that area. Hypopigmentation, however, is decreased pigmentation in that area compared to the surrounding skin. This condition is very common. Yeah, I know we talk a lot about hyperpigmentation, but hypopigmentation is very common, and studies have shown that 1 in 20 people have this condition, and it is even more prevalent in people of color, like people with my kind of skin tone. And it's one of the reasons people will seek medical help for, not because it is kind of dangerous to the health generally, but because of its cosmetic concern and social stigma. So let's look at the physiology of the skin, because that will really help you understand this term. It will help you understand how it comes about. It will help you understand maybe causes and the other things that we'll be talking about in this video. If you see me looking here, it's because I have my outline and my notes so I don't miss anything. Okay. So the skin is made up of 3 layers. We have the epidermis, the dermis, and the hypodermis. The hypodermis is the deeper layer of the skin, but the epidermis is further divided. Oh my God, something bite me. The epidermis is further divided into 5 different layers. Right? The epidermis, which is the outer layer of the skin, is about 1 millimeter thick and is further divided into 5 layers. So we have the stratum basal, that's the deepest layer of the epidermis. We have the stratum spinosum, the stratum granulosum, stratum lucidium, and then the stratum corneum, which is the superficial outermost layer of the epidermis. Now, melanin production takes place in the basal layer, that's the deepest layer of the epidermis. And melanin, of course, it's the pigment that gives our skin color. We as people of color have eumelanin, which is the brown pigment, which is quite different from pheomelanin, which is the lighter pigment we see in other skin tones. And the primary purpose of our melanin is to protect us from UV rays and UV damage. So in the event of exposure to UV rays, there's some physiological and chemical reactions that happen in the basal layer that leads to melanin production. I know that you've heard about tyrosinase, and it's an enzyme, the rate limiting enzyme for melanin production. I'm not going to go into the details of how tyrosinase is produced in the basal layer before leading to the production of melanin, because we're not in a chemistry class here. We're not in a biology class. I know most of you are here for the cosmetic results, treatment, and solutions. So let's keep it at that. When your skin is exposed to UV rays, some things happen in the basal layer of the epidermis, and melanin is produced. And tyrosinase is the rate limiting enzyme for the production of melanin. So when melanin is produced by the melanocytes, they are packaged into like an Amazon box. Think about an Amazon box, right? This melanin is packaged in melanosomes and transferred to the keratinocytes. Keratinocytes are basically a fancy term for skin cells. And now, when the skin is shedding, because you do know that the skin is a living organ, it lives, it sheds, it dies, it sheds off. So as the skin sheds off, the melanosomes start to migrate from the basal layer to the granulosome lucidium, go through these 5 layers, and then that melanin is deposited to the surrounding skin, on the surface of the skin, and that's how we can see this color. It starts deep down there, and that's why in the treatment of hyperpigmentation, it's very important to target all steps of melanin production, because you cannot just apply one serum on your skin and expect that will clear your melanin. That's not how it works. The production starts somewhere deep down there, and it migrates gradually. So you have to exfoliate your skin, you have to speed up skin cell turnover, you have to block that tyrosinase that's producing the melanin. A lot of steps go into it. Because I'm saying this because some people just come and tell you, please, what products can I use for hyperpigmentation? It just doesn't work like that. There's no one product. You have to target each step of the melanin producing process to achieve results. But we're not talking about hyperpigmentation. I just wanted to mention that. How does hypopigmentation come about? What causes hyperpigmentation? There are so many causes of hyperpigmentation. I'm going to group them into different categories, but I just want to mention that because you have hypopigmentation, it doesn't mean that it's from using bleaching creams. And that is what so many people have in mind. You see somebody with hypopigmentation and you just automatically think that they were trying to bleach their skin. It's not the case. There are so many different reasons or causes of hypopigmentation. Most of it is benign. It could be malignant, but a majority of causes of hyperpigmentation is benign. Benign means it is not cancerous. Malignant means it is cancerous. And most of these causes like are acquired. You're not born with them, right? Albinism is a hypopigmented condition which you're born in with, but we're not talking about that. We're going to talk about the acquired causes of hypopigmentation. So the first cause we're going to discuss is normal skin changes in skin aging and exposure to UV rays. So this is mostly seen in the elderly, people who have been exposed to the sunlight for a very long period of time, and then normal skin aging. So you may see like your mom, your aunt with hypopigmented lesions. It's not because they used the bleaching cream. It's just a normal physiological result of prolonged exposure to sun rays and skin aging, and that's called idiopathic guttate melanosis. IGH for short. The next cause of hypopigmentation will be infections. Infections can cause hypopigmentation. Infections with fungi or bacteria. The acne-causing bacteria, C. agnes, previously P. agnes, can cause hypopigmentation, and that's what we call progressive macular hypomelanosis. Progressive macular hypomelanosis, PMH. Also, fungi can cause hypopigmentation. Fungi like Malassezia species. Malassezia is normal commensal of healthy skin, but it could become pathogenic and lead to a fungal infection. Factors like humidity, environmental factors, maybe genetic predisposition, excessive oiliness on the skin, using oily creams or lotion on your skin can cause this normal commensal of the healthy skin to become pathogenic. So there's like overgrowth of the fungi on your skin, leading to a fungal infection. And what happens is this pathogenic form of the fungus metabolizes fatty acids on the skin and releases azelaic acid. Remember, azelaic acid is treatment for hyperpigmentation because it blocks tyrosinase, the enzyme that leads to the production or synthesis of melanin. Now, if Malassezia metabolizes these fatty acids and releases azelaic acid. Of course, azelaic acid will inhibit pigment production and lead to hypopigmentation. That's how you get hypopigmentation from fungal infection. So you may see patches of your skin become whiter than the rest of the body. It's a fungal infection sometimes. Another cause of hypopigmentation is inflammation, like pityriasis, alba, which is associated with atopic dermatitis or eczema. Another cause of hypopigmentation could be inflammation, and I would categorize this under chemical inflammation, which is where your bleaching creams come in, lead-based cosmetics, creams with steroids, hydroquinone, even chemical agents used to remove tattoos or for other cosmetic procedures, even cleaning agents. You can get a chemical burn or injury and inflammation from cleaning agents that can lead to hypopigmentation. Another cause of hypopigmentation could be nutrient deficiencies, maybe copper, iron, B12 deficiencies. People with kwashiorkor have hypopigmentation. That's one of the causes. So if you develop hypopigmented lesions on your skin and you just don't know where it's from, it could be a nutrient deficiency. Another cause could be autoimmune. We're not going to get more into that, but this is a situation where your body attacks its own immune system. We see that in vitiligo. Yeah, it could be autoimmune. There could be post-inflammatory changes as well. That's just like trauma or injury to the skin that causes hypopigmentation, decreases or destroys some of the melanin producing cells, decreasing pigment in that area. So yeah, that's basically some of the causes or major causes of hypopigmentation. And we're not going to go into malignant causes. It could be, but it's rarely malignant. All right. So now that we have looked at the causes, let's look at diagnosis. In fact, the cause is imperative for treatment. And this is where diagnosis comes in, because diagnosis is basically trying to decipher the cause. Not every hypopigmented lesion is the same. The cause is going to determine the treatment. So if you just see a hypopigmented spot on your skin, you cannot just say, it's because of bleaching cream, or use this, or that person used this, I'll use it too. It doesn't work that way, because it has different causes, and each cause has a specific treatment. That's why you cannot just take a picture and send to me and say, Doc, I have this, what should I use? I don't know what you should use. I don't know. I need an evaluation of that condition. I need to evaluate physical exam, his history taking, something. We need diagnosis. We need paraclinicals to be able to come up with a treatment plan. Some people just don't understand it. Like, you just enter my DM, my WhatsApp, my Instagram DM, send me a picture and say, what should I use? I don't know. It's more complicated than that. Yes, sometimes you can have a spot treatment, but physical exam evaluation is still necessary to be able to come up with a definitive diagnosis and treatment. That's why when they say pay for consultation, you get why. You pay. You have to pay, because if it was just about taking pictures and asking what should I use, we will not be in med school for 8 years suffering there. All of us will Google our symptoms. It's always important to get a consultation, no matter how minute or small you think the problem is. If it was that small, you will not be looking for a treatment. I think I've noticed is that people like shortcuts. People don't want to go to the hospital, and I don't know why. But you want to get expert advice from the comfort of your home, and you don't want to pay. Some of you, be respectful. Respect this profession. I know that sometimes when someone will even send me a picture and say, please, what should I use? And then you start asking questions like, when did it happen? What's the nature of the lesion or whatever? And then they're angry, like, just tell me what to use. It's not that simple. You need a consultation, you need an evaluation, you need a history and physical exam to be able to determine, because it looks like eczema doesn't mean it's eczema. See, some of you people, be respectful, respect the profession. If I say consultation is 5K, pay your 5K and get your expert advice. If you don't want expert advice or opinion, please step aside. Anyway, like we were saying, I'm sorry for shouting. I'm sorry. But yeah, sometimes let's be respectful. Let's be guided. So yeah, we need an evaluation and physical exam to be able to determine the cause of hypopigmentation. And so when you get to the doctor will ask you questions. Will ask you maybe exposure to chemicals, prior history of inflammation. They'll look at the lesion, they'll look at the size, they'll look at the distribution, they'll look at the pattern, they'll ask you if it's itchy. There's a lot of questions and physical findings that is necessary to make a diagnosis. And then after a physical exam, you can there will be evaluation. So there are different ways that that lesion can be evaluated. It can be like a histopathology can be done, which is what I had. We're going to talk about my own case in a little bit, but then there will be a skin biopsy. Skin biopsy actually gives the most accurate diagnosis, but it's not always done, like not all the time. But if you do get skin biopsy and histopathology, you will have the most accurate diagnosis. And this is where the skin is part of the skin is sent to the lab and examined under the microscope to see the changes in the skin. They look at the melanin, the melanocytes, and different, how do I put this? Different etiologies will show up differently under the microscope. So say if the hypopigmentation is secondary to a fungal infection, you'll be seeing things like spaghetti meatball appearance under the microscope, and it will be different for IgH, it will be different from other causes of hypopigmentation. That's why it's important to get evaluation. You may also have the doctor perform a Woodlam's test, or dermatoscopy, or electron microscopy, or sometimes a KOH mount of the skin scraping. If they're suspecting a fungal infection, the scrape part of the skin, they look at it under the microscope in the lab. They might see hyphae to point to a fungal infection like tinea, versicolor, and stuff like that. So evaluation is important in coming up with a definitive diagnosis. Now, let's take a break and look at my case. I think about 4 years ago, I noticed I had hypopigmented spots on my legs and arm. And the thing was interesting because it had the same distribution, the same pattern. I'll insert a picture here. The same distribution on my hands and on my legs. And for some time, I used to itch a lot on my ankles and my wrists. Like, I'll just scratch and then go about my day. I never really paid attention to it. And then there's this day I went to fetch water. And for some reason, while I bent down to pick the bucket, I was wearing shorts. And then I saw my leg, I was like, shoot, what in the world? And at that time, I was using amlactine. I've always been using amlactine. That was about 4 years ago. And I'm like, this cannot be amlactine. So what the heck is going on? I don't use tretinoin on my skin. It was basically just amlactine. So I was confused. Like, I didn't know what was up. I consulted the dermatologist. She asked me some questions, and then we did a skin biopsy. This is the day I did my skin biopsy, and I was so mad because I knew that I'm going to get hyperpigmentation from this trauma, but it was necessary to come up with a diagnosis because I was not just about to get treated without even knowing the cause of the hypopigmentation. So we did a skin biopsy, sent it to the lab, and then my histopathology results came out. I cannot find that results. I think it's somewhere in our old house. I sent it to my fiance at the time. He doesn't have it anymore, but my results came back showing it was atopic dermatitis eczema. That was the cause of my hypopigmentation. So we'll look at my treatment after we after we go through treatment of this condition. So let's look at treatment. Now that you've had diagnosis, now that you're sure that this hypopigmented lesion you're having is from bleaching cream, or it's IgH, or inflammatory, it's atopic dermatitis, or it's infection. Once that is established, we need a treatment. Now, treatment is going to be effective depending on so many factors. Like if it's a bleaching cream, you need to stop immediately, abstain from that. If it's prolonged sun exposure, you need sunscreen. Timely intervention and prompt treatment really determines how well you will respond to treatment. And if you are getting treatment for this condition early, basically that's what I'm saying. If you're getting treatment early for this condition, repigmentation is sure. But if you do not get evaluation and treatment early, it may take a very long time for repigmentation to happen. So these are the basic things you need to know. Avoid the causative agent, wear sunscreen, make sure that your barrier is nurtured, your barrier is strong, you're using barrier strengthening products, and you're just getting timely treatment. So topical steroids is one of the very first line treatments for hypopigmentation. It speeds up repigmentation, and it can be used with other things. It can also be taken orally, but yeah, topical steroids is one of the treatments. I got topical steroids. I'm not going to tell you the percentage, the type, or how long I took it, because some people like to self-medicate. My light just went off. Some people like to self-medicate, and I'm not going to do that because I don't know. There's something about people. Like, I don't know why. Why do people not like going to the hospital? They just want a quick fix. They want an easy way out. Is it because it's expensive? I understand it can be expensive, plus the long lines in the hospital. But the cost of self-treatment can be 10 times more than just going and getting proper checkup and professional help. Sometimes it's not the easy way out. Sometimes it's more expensive. So yeah, like we're saying, oral or systemic or topical steroids is one of the treatments. And then we also have topical calcineurin inhibitors, and these are immunomodulatory agents, and they help repigmentation by inhibiting the synthesis and the release of pro-inflammatory cytokines. We also have like oral isotretinoin. Like I mentioned, you remember I said that bacteria can also be the cause of hyperpigmentation. The acne causing bacteria can be the cause of hyperpigmentation. So if that's the cause, oral isotretinoin is the treatment. And oral isotretinoin should be taken under supervision of a professional. You cannot get it over the counter, so don't even think about it. Antifungals too could be a management option if the cause of your hyperpigmentation is a fungal infection. And then vitamin D2 is one of treatment options. And literature review actually shows an association between vitamin D and pigmentation. Vitamin D increases melanogenesis by increasing tyrosinase content of the melanocytes. Remember, tyrosinase is the rate-limiting enzyme for the synthesis of melanin. So vitamin D does that. I think this would be a good option for people who are suffering from hyperpigmentation from IGH, like skin aging and overexposure to sunlight. Vitamin D can help. And then generally, emollients, skin emollients containing urea. A urea-based lotion really helps your skin heal. It helps your skin repair itself. I also got a urea-based lotion alongside my dose of steroids at the time for my treatment. So these are the various treatment options. And I'm just going to say this. If your hypopigmentation is due to bleaching creams, because I know a majority of people watching this video wants the solution for hypopigmentation secondary to bleaching creams, I have two things to tell you. Stay away, stop using that cream immediately, and jump on a urea-based emollient. There are many of them. There's Balea, very cheap. There's Eucerin. There's La Roche-Posay. That's the best you can do, and then give yourself time to heal. Repigmentation will happen, but it takes time. Mine took a year and some months for everything to disappear. Yeah. I didn't take steroids and use urea for all that time. I think I took steroids for a short period of time. I don't remember how long. Even if I remember, I'm not telling you. But yeah, I took steroids and then I went on the urea-based cream for a couple months. I stopped. I went back to my regular amlactin. And with time, repigmentation happens. Even without steroid or treatment, sometimes if it's due to eczema, atopic dermatitis, repigmentation will happen. If it's due to a bleaching cream, if you stop the bleaching cream and just nourish your skin with emollient and give it time, repigmentation will happen. It's not going to happen in 2 months, 3 months, 6 months. It may take a year. It may take more than that. You just have to be patient. There's no shortcut to it. Okay. And yeah, that's basically it. I don't think there's anything else that I have forgotten. I ended up not looking at my notes, but if there's anything I've forgotten, I would ask me questions in the comment section and I will answer. And I hope that you learned something from this video. I really hope that this video was helpful, and if it is, share it to someone who might need this. There are so many people struggling with this condition. They don't even know how to go about it. If you need consultation, you can email me, but please don't send me your picture and say, what should I use? Like, no, it doesn't work that way, right? But if you're going through this condition, I wish you well. I wish you speedy recovery. And I pray that you would, you get your skin back, because honestly, it's very, 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 like, the social stigma is wild and it's very unpleasant. Honestly, it's very unpleasant, and I really hope that you get healing in the name of Jesus. Thank you so much for watching. I have reviewed some really nice body lotions for hyperpigmentation. If you want to watch that video, check it out here, and let this not be your last. If it's your first time here, please let it not be your last. Check out other videos, and in the next video we'll be looking at vitamin C. I think someone requested that I talk about vitamin C serums. That video will be juicy. That video will be packed. You have to see, turn on your bell notification because we're going to get into vitamin C. I'm going to give you practical, the tea, the product recommendations, everything. You know how I do it. All right. Thank you so much. I really appreciate you sticking to the end. Subscribe, leave a comment, share the video, and I'll see you in my next one. Shalom, shalom.